Everyone. Good evening, everyone. Welcome to Towards Health Justice, Voices of Black Women, presented by the National Coalition of 100 Black Women, Dallas Metropolitan Chapter, the American Cancer Society, and Zeta Phi Beta Sorority, Incorporated, the Kappa Zeta Chapter. We're so glad that you could join us this evening for a meaningful conversation on cancer, Black women, and how we can make a difference. Tonight's program is grounded in a simple but urgent reality. Black women deserve to be heard, believed, and counted in the fight for health justice. So, tonight, as you listen, learn, and reflect, we invite you to take the next steps. Complete the survey, share it with your circle, encourage your daughters, your aunts, your coworkers, your line sisters, your church family, and everyone in your network to get involved. This is how we build momentum. This is how we impact change. Uh, so, our agenda, as you can see, includes we will have speakers, dynamic speakers, I must say, from the American Cancer Society, and we will allow all of our participants to pose questions to our esteemed panel. And then we will have a wrap up and discuss some of the upcoming programs. We will discuss the purpose and impact of the voices of Black women, study the critical need for participation, and as mentioned, if there are concerns and questions. I'd like to turn over our presentation now to the president of the Dallas chapter, the National Coalition of 100 Black Women, Dr. Katrina Pullum. Dr. Pullum?
Good evening, everyone. It is an honor to sit here before you this evening as the president of the National Coalition of 100 Black Women, Dallas Metropolitan Chapter, as we for gather for Towards Health Justice, Voices of Black Women. Tonight is not just a program, it's a declaration that the voices of Black women matter. Our health matters. Our lived experiences matter, and our advocacy will not be silenced. At the National Coalition of 100 Black Women Incorporated, our mission is clear: to advocate on behalf of Black women and girls, to promote leadership development and gender equity in the areas of health, education, and economic empowerment. Health justice sits at the intersection of all three, because when a woman's health is compromised, her education is interrupted. When her health is neglected, her earning power is diminished. When her body is not protected, the leadership is restricted. And we reject that reality. Our vision is to see Black women and girls live in a world where socioeconomic inequity does not exist, a world where access to quality health care is not determined by zip code, income, or race, a world where prevention, early detection, treatment, and survivorship resources are equitable and accessible. So, towards health justice means we move beyond awareness and into action. It means we amplify the voices of Black women who have been unheard in clinical spaces, overlooked in research, and underserved in systems designed without us in mind. This is why partnership is so powerful. So we are proud to collaborate with the American Cancer Society, whose commitment to research, advocacy, and community outreach helps close gaps in cancer prevention and care. We are equally honored to partner with the Kappa Zeta Chapter of Zeta Phi Beta Sorority Incorporated, a sisterhood rooted in scholarship, service, sisterhood, and final womanhood. Together, we demonstrate what collective impact looks like when mission aligned organizations unite for a greater call. So, Black women are often the caregivers, the cultural keepers, the backbone of our families and communities. Yet, too often, we are the last to seek care for ourselves. And so, tonight, we change that narrative. We empower Black women to prioritize preventive care, ask informed questions, participate in clinical research, advocate for equity. Oh, excuse me, y'all, tongue-tied. Advocate for treatment, and most importantly, listen to your bodies. I am a witness to that. So we are moving towards health justice, and we are moving towards health justice together. Thank you, and please enjoy the program.
Good evening. I'm Dr. Mahalia Jackson Butler, member of the National Coalition of 100 Black Women, Dallas Metropolitan Chapter. I have the pleasure of introducing the keynote speakers this evening, Ms. Mary Tillman Young and Ms. Kayla Jalibwa. Mary Tillman Young, Strategic Director for Diversity, Equity and Inclusion, South Region, American Cancer Society. Mary Tillman Young is a respected leader in diversity, equity, and inclusion with more than 10 years of experience advancing health equity and social justice. At the American Cancer Society, she leads regional and national strategies to reduce cancer disparities and expand access to care. Her work includes raising critical funds to support health equity programming, cultivating key partnerships, driving investment, stewarding executive engagement, and collaborating with stakeholders to advance inclusive solutions. Born in New Jersey and reared between Maryland and the Caribbean island of St. Kitts, Mary's global perspective and personal experiences have shaped her lifelong commitment to equity. Her career includes leadership roles in housing, education, healthcare, as well as consulting with organizations to strengthen their corporate social responsibility and inclusive strategy efforts. Mary earned her degree at the University of Texas, Arlington, and completed executive programs at Southern Methodist University and Cornell University. She is the founder of MTY Consulting, a BIPOC-owned firm dedicated to nonprofit excellence and inclusive innovation. She is also a proud member of the Zeta Phi Beta Sorority Incorporated. Kayla Jalibwa, MPH, leads outreach and partnership development on the Voices of Black Women research team. This includes building relationships with partner organizations, supporting the implementation of recruitment activities, and coordinating grant-related programming. She has previous experience in strategic health communications and has conducted research focused on improving Black women's maternal health outcomes. Before joining ACS, she supported communication efforts for diabetes management and other public health campaigns at the Centers for Disease Control and Prevention. She developed strategies that made complex health information more accessible and actionable. She has also contributed to research focused on the drivers of inequity in Black maternal health outcomes and the development of community-centered solutions. Welcome, keynote speakers.
Good evening, everyone. I am Cornelia Hicks, a member of the National Coalition of 100 Black Women, Dallas Metropolitan Chapter, and also president of the Kappa Zeta Chapter of Zeta Phi Beta Sorority Incorporated. Founded in 1920 on the campus of Howard University, Zeta Phi Beta continues to stand on the steadfast principles of scholarship, service, sisterhood, and finer womanhood. Under the visionary leadership of International President and CEO, Dr. Stacey N.C. Grant, we proudly embrace the extraordinary power of she, social health and economic justice. This initiative challenges us to be intentional and action-oriented in addressing issues that disproportionately impact women of color. Here at the Kappa Zeta Chapter, we are deeply committed to amplifying the voices of Black women through advocacy, education, and community engagement. Tonight's conversations reflect that commitment as we focus on our philanthropic pillar of health justice.
We will spotlight the remarkable contributions of Black women in research and explore how their work is helping improve cancer outcomes and eliminating health disparities. Welcome, and thank you for your participation and partnership this evening.
Good evening, everyone. Thank you so much for that warm welcome. Dr. Jackson Butler and Dr. Pullum, thank you so much. Soror Hicks as well. One of my favorite things about doing these engagement opportunities is exactly how Dr. Pullum shared about our intersectionality. And I am here with you all today, really in the center of so much of that intersectionality for myself. Being a proud member of Zeta Phi Beta Sorority Incorporated, also representing the American Cancer Society, it is my pleasure to be here with my colleague Kayla and talk to you about our Voices of Black Women cohort study. Next slide, please, Kayla. Today, we're going to talk a little bit about what is health equity. I know Dr. Pullum and Dr. Jackson Butler both framed this health justice. Today, we're going to connect those with how the American Cancer Society addresses health equity. Then we're going to talk about what is the problem. Mentioned as well earlier, we talked a little bit about just how our unique lived experiences as Black African American women in this country shape our health outcomes in so many different ways. And we're going to talk about what that problem is. Then we're going to talk about how we can imagine the solution together and what it looks like to participate in the Voices of Black Women cohort study. Let's talk a little bit about the American Cancer Society. I always like to share with folks that before I joined the American Cancer Society, I would see the red, white, and blue, and maybe I remember being at the grocery store and checking out and someone saying, "Oh, do you want to round up for the American Cancer Society?" But I had no idea the breadth of which the American Cancer Society truly works within communities to advance our mission of health equity. Our vision is to end cancer as we know it for everyone. I like to emphasize those last two words, for everyone, because while cancer impacts everyone, what you're going to find out tonight is that it does not impact everyone equally. There are disparities that exist as it relates to cancer outcomes. We are trying to solve for those at the American Cancer Society because we believe that everyone should have the opportunity to prevent, detect, treat, and survive cancer. One of the ways that we do that at the American Cancer Society is through what we call a tri-pillar approach. Outside of the US government, we are the second largest funder of cancer research. However, what you're going to learn about tonight is in addition to being a cancer research funder, the American Cancer Society actually conducts our own research. Some of the most historic findings as it relates to behaviors and outcomes have come out of the American Cancer Society studies. Things like the linkage between smoking and lung cancer, that came out of the Ham and Horn American Cancer Society study. In addition to doing research, we take that research and we create targeted programs to help reduce disparities. Things like our patient support programs. Right here in our Dallas community, we have our Jean and Jerry Jones Hope Lodge. That is a place where people can go and stay for free as long as they need to while they are receiving treatment, whether that's participating in a clinical trial or receiving any type of treatment for their journey. In addition, we have our things like our Road to Recovery program, where people are able to take advantage of free rides to and from treatment. And then we have our advocacy pillar. And what we know is it is wonderful to have all of these innovative treatments that are made available, but unless we can access them, we won't be able to see the needle move as it relates to our health disparities. And that's what we do through our advocacy pillar. We work alongside legislators to make sure that they are aware of the impact of cancer in their very own communities and how the American Cancer Society and the American Cancer Society Cancer Action Network is working to reduce the disparities that exist and advance access to care. One of the things that I love here is this bottom tier where you see it says 20,000 plus communities. We are only able to engage with 20,000 plus communities because of organizations like the National Coalition of Black Women and Zeta Phi Beta Sorority Incorporated, both of which are national partners of the American Cancer Society. So when we say we engage in 20,000 communities, we truly mean we. Everyone here on this call is reflected in that number, and we're so thankful to be in partnership with organizations who are prioritizing health and wellness. We're going to talk a little bit about what some of these disparities are that specifically exist in the Black African American community. When we think about disparities, we're talking about the differentiating outcomes. And if you see here on the screen, you'll see a few different statistics as it relates to our specific community. What we know is that unfortunately, 19% of Black men are more likely to die from cancer than white men. We know that breast cancer mortality is 38% higher for Black women in the United States than our white counterparts. We also know that African American males are 45% more likely to die from colorectal cancer than our white counterparts. And finally, we know that prostate cancer mortality amongst Black men is approximately double that in every other ethnicity and race. One of the things that I like to share whenever we're talking about the disparities that exist in the Black African American community is that it's not without reason. Today, we're going to talk a little bit about some of the historical context and why the American Cancer Study has launched our Voices of Black Women cohort study so that hopefully in 5 years, in 10 years, when we're having this discussion, these statistics you see on the screen will be drastically different. Before we talk about how we are going to work together through our Voices study, I want to lead us in a little bit of a self-reflection activity. When we talk about health equity and health disparities, so often it can be so tricky to really experience that for ourselves and understand within the context of our own lived experience. It's funny, whenever I talk about health equity or advancing access to care, I talk about my 96-year-old bestie, who is many of our sorors, and just her experience and her lived experience as it relates to healthcare is going to be drastically different from my lived experience as it relates to healthcare. And so I'm going to lead us in an activity where we're going to reflect a little bit about our own lived experience, and that's your entire life. So everything from as far back as you can remember to your current lived experience. And I'm going to ask these questions, and I just want you to reflect either yes, no, or maybe it's something that you can't quite pinpoint and you're unsure of. So the first question is, have you ever delayed seeking medical care because of cost? Have you ever delayed seeking medical care because of cost? And I'm talking about any kind of delay. I'm talking about being an undergrad and maybe you don't have the resources and you're thinking, "Ooh, do I get lunch or do I pay this copay and go get this resource that I need or get this medication that I need?" Have you ever delayed seeking medical care because of cost? The next question is, have cultural beliefs, family values, or aspects of your identity ever made you hesitant to seek health care? And I'll speak a little bit on this one because this is something that I personally can identify with, especially having grown up in a family where faith was such a big part of our lived experience and how we operate and how we exist in the world. There were often times where I had to have difficult conversations, and I still have these conversations with my 96-year-old bestie to this day, where, I'll say, "Oh my goodness, my stomach is hurting or something doesn't feel right, and I'm thinking about going to the doctor." And she'll ask me, "Well, have you prayed on it?" And the answer is yes. And I'm still going to seek care and make sure that I have the opportunity to figure out if there's something else going on and just have all of the information at my fingertips. So sometimes, as you're thinking and reflecting on this question and how you would answer for yourself, think about things like our values and our spirituality and how that can sometimes impact our experience with healthcare. The next question, have you ever faced challenges getting to healthcare appointments due to transportation barriers? Again, have you ever faced challenges getting to healthcare appointments due to transportation barriers? And when you're thinking about this one, I wanted you to think about it in a couple of different ways. So there's the actual, do I have a physical ride? Do I have a vehicle to get into? Or do I have someone to give me a ride? But then I want you to think about some of the complexities. I can tell you, and many of my sorors can attest to this, that sometimes I can be extremely busy. And so because of that, one of my transportation challenges is that I don't take the time to stop to ensure that I have enough time to get to my appointments and to seek the health care that I need. So when you're thinking about how you're answering that question, think about it in that way as well. And then finally, did you grow up in a community with limited access to fresh fruits and vegetables within 10 miles of your home? Again, did you grow up in a community with limited access to fresh fruits and vegetables within 10 miles of your home? This question is always interesting to me, especially because, as Dr. Jackson Butler shared, I grew up in the Caribbean island of St. Kitts and Nevis. And so, what access looked like there is very different than what access looks like in the United States. And so, as you're thinking about, did I have access to fruits and vegetables within 10 miles of your home? I also want you to think about, how did vegetables get to your home? So for me, sometimes that meant maybe my grandmother brought vegetables, or maybe I had a family member that would take me someplace to get vegetables and fruits. When you think about these questions, we want to challenge you to think about all of the different ways in which we identify our health journey. It's so easy when we're thinking about health equity to sometimes think about it from the lens of just, do I have access to healthcare or do I not? But that's truly not the only way to think about access to healthcare. And we also know that all of the outcomes that we're going to talk about today, they all involve all of these lived experiences. We also know, due to the American Cancer Society research, that these types of lived experiences are directly linked to cancer outcomes. So I wanted to start with this to just give you an opportunity to reflect and think about your own lived experience as we talk today about how we are advancing health equity, the disparities that exist, and what part you can play in reducing them. At the American Cancer Society, we we define health equity as ensuring that everyone has fair and just opportunity to prevent, detect, treat, and survive cancer. I love this picture to the right, and you may have seen a different iteration of this picture floating around as it relates to the words equity and equality. We want to be very clear in how we define this because it's so important to correlate our definition with our direct approach to reducing cancer disparities. When we think about all the things that we just talked about, so everything from where we live to access to fresh foods and vegetables to our own lived experiences, whether that's family values and spirituality, we know that they're all different. And so are cancer outcomes. And so, in order to address the disparities that exist in our specific community, we have to have a unique approach. A unique approach is what is going to help support the reduction of these unique disparities. I love the picture at the top because that's what it would look like if we were to approach all of cancer outcomes in the same way. But that's not what we're doing at the American Cancer Society. We're committed to finding out, okay, how can we support our neighbors who might not be able to get to their appointments? Let's think about that Road to Recovery program that I talked about at the beginning. Okay, what does it look like for our neighbors who maybe have mistrust in the healthcare system because of historical harm? Let's talk about the Voices of Black Women cohort study and have conversations like we're having tonight to help answer questions. Next slide, please.
Mary, sorry, I just wanted to interrupt you real quick. On my end, you're showing up as muted, so I can't hear what you were saying when this slide started.
Okay, thank you so much. Can you all hear me now?
Yes.
Okay, perfect, perfect. I was sharing that we know that 80% of what influences health is not medically related, and that goes directly back to all of the behaviors and the lived experience that we talked about as it relates to our own health equity journeys. I love looking at these icons on the screen because sometimes it's easy to not understand how all of the iconology can reflect in our own lived experiences with cancer outcomes, but just in health with health in general. One of the things that I always like to call out is financial stability. When we're thinking about how health can impact, or I'm sorry, how financial stability can impact our health outcomes, it's really important to think through the myriad of experiences and how there's so many different lived experiences as it relates to finances and our health. Things like I know from my own lived experience, I have family members who have said, I know you told me to get that screening, but I didn't go because it meant I would have to take off of work. And if I took off of work, I knew that that would impact me being able to make rent. That's just one example of how financial stability can impact our decision making. I also think about social environment. We're going to talk a little bit about that later in our presentation today. But when you think about just the lived experience, and I shared, my 96-year-old grandmother's lived experience versus my lived experience versus that my mom had, they're all vastly different. And that history carries on. I hear about stories from my grandmother when she's sharing about the mistreatment that she experienced. I heard about stories from my mother about the mistreatment that she experienced and the mistrust. So when we hear those stories, what does it mean? And how does it translate into how we show up for ourselves with healthcare today? I'm excited because we are not in a deficit. We have the opportunity to link arms together to advance the mission of the American Cancer Study, but most importantly, to impact generations to come. I'd be remiss if I didn't pay honor to the most recent loss of Reverend Jesse Jackson. At the American Cancer Society, we're actually very privileged to have Reverend Jesse Jackson come and speak at one of our conferences. And this is what he said about cancer disparities at our conference. He said, the disparities gap is growing wider, and sometimes it seems like the bridge may be impossible to build. But this is a problem that can be solved, and we cannot be daunted by the challenges. I'm going to turn it over to my colleague Kayla, who's going to talk about what that problem is and who's going to talk about how we get to solve it together. Thank you, Kayla.
Thank you, Mary, so much for setting up the stage for the Voices study by really explaining what health equity means and all those different aspects that can contribute to our health and health outcomes. Before diving into things, I actually wanted to kind of bring in some context by zooming in to a statistic that Mary had shared earlier that Black women are 38% more likely to die from breast cancer than white women. When you see a number like that, it's almost 40%. That is truly an indication of a crisis that's going on. But at the American Cancer Society, we understand that behind every statistic that we see like this, there is a story. And behind every story is a woman who's a sister, a mother, a daughter, or a friend. And the Voices of Black Women study is really about changing those individual stories by understanding why these disparities exist and how we can use science to end them, and also by listening to the voices of Black women themselves. So, I understand that cancer is probably something that impacts most of us, if not all of us, here on this call in some way. And at ACS, we're really working to be part of the solution. So I'm going to take some time today to share what the Voices of Black Women Study is about by talking about what it means, why it really matters, specifically in the context of today's world, and how you all on this call can be a part of the movement. So just to give a few more statistics, last year in 2025, there were almost 250,000 Black people who would find out that they had cancer, and 73,000 Black people who unfortunately passed away from cancer in the past year. And over the past 3 decades, there have been really significant discoveries made in cancer science, as we see fewer people using tobacco, and diagnosis and cancer treatment has improved. There has been a decline in cancer mortality overall. But despite the progress that we've seen in cancer mortality across different groups, it still remains that Black women are more likely to die from cancer than white women across all cancer types. And we know that genetics plays an important role in cancer, but only a small fraction of this Black-white difference that we see can be attributed to genetics. As Mary described earlier, we know that a large portion of disparities are due to differential access, both to quality screenings and quality health care once people get diagnosed. But currently, we're seeing that the contributions of things like institutional and interpersonal biases and racism in society at large and healthcare, more specifically, are largely under research and unresolved. So, this is an emerging area that we hope to uncover with the results of this study. And also, nearly absent from the research so far are some of those buffering factors and things like community resilience that we know are able to have a positive impact on disease outcomes. And so things like resilience are really components that we're focused on in the design of the Voices of Black Women study, because we don't just want to be focused on those disparities. We want to identify the things that are unique within this community, that are protective and buffering factors for people. And when we think about how do we begin to resolve some of these questions or close the gaps that we're seeing in these disparities, and really that is through research. But we know that historically, Black women have been less likely to participate in health research. So this study intentionally places Black women at the center of this cancer research. And the work that we're doing through Voices is necessary so that we have a large enough size and scope of people to be able to better understand what are some of these drivers of the health inequities that we're seeing in Black women. I also just wanted to quickly share, to give context to the issue, is that Black women are more likely to be diagnosed with cancer at later stages. They're more likely to have more aggressive forms of cancer. They're less likely to be offered the best treatments or really to be listened to at all in a healthcare setting. And these disparities are growing larger when you look at younger populations. And the big question surrounding this is why? Why is this our reality, and what is driving this? So, like I mentioned, we don't just want to focus on the deficits and disparities. We really want to look towards what can be done about this issue and how can we play a role in that. So, as a leading research organization at the American Cancer Society, we know that there's always work to be done. So, in 2024, we expanded our population cohort studies by launching the Voices of Black Women study. This was an idea that came about way back in 2022. We began laying the foundation for expanding this cohort studies to include to focus on Black women, and this culminated with the launch of the study in 2024. And the primary goal of Voices is to understand why is it that Black women are getting and dying from cancer at higher rates than all other racial and ethnic groups. So the hope is that Voices will help to better understand the drivers of cancer and other health conditions among Black women in the United States so that we learn how to be able to better address them. And this research will inform strategies to improve cancer prevention, cancer treatment, and survivorship amongst Black women, and can lead to improvements for cancer outcomes, not just for Black women, but for all Americans. Because when you put Black women at the center of research, the benefits that we see for this population are going to expand towards the larger population as well. And we have never conducted a cohort study like this before. So at this scale and hyper focus on a minority group, Voices will be the largest study of Black women to date. And at the American Cancer Society, we do have a long legacy of conducting large population studies. We've been doing this for over 70 years to understand how cancer is developing in the population and how we can improve quality of life for people who've had a cancer diagnosis. And as Mary mentioned earlier, our very first cohort study was focused on a question that was contemporary at that time, but does smoking cause lung cancer? Or are they linked? And we know the answer to that is yes. So now in 2026, with that same tradition, with each new study that we're developing, it has addressed some of the most pressing questions around cancer risk and prevention at that time. So this is just continuing with our legacy and tradition of tackling new and important and emerging research questions. And we've worked with about 2.5 million participants over this 70-year span, but identified a really critical need to launch this new study that would be large enough to better understand, like, what are those drivers of health inequities specifically in Black women? Because Black women across the US, we all know, not a monolithic population. We have really diverse ancestry, different socio-behavioral experiences, and we all encounter unique barriers that are worth studying and are worth understanding. So, with the size and scope of this study, this will help us to learn so much about health and lived experiences of Black women. So I just want to take a moment to show a video outlining the study and emphasizing its importance in today's world.
for too long, Black women have suffered disproportionately from rates of cancer and other diseases, and with very few exceptions are more likely to die of cancer than any other race or ethnic group.
This study is entirely what we call observational. You are sharing with us how you live, what you do, what you may be exposed to in your life, and we're collecting that information from you.
Voices of Black Women is really to dig into that lived experience of Black women. We dig into aspects around trust of the medical care system. We dig into experiences of racism and discrimination and where that comes from. You're telling me if I give you this information, it might give you insight into why we are getting cancer at higher rates, why we are dying at higher rates. I feel like it's an easy ask when you look at it from that perspective. Everything that we're going to learn is going to impact Black women's health for the better. This is more than a health survey. That's why we call it a movement.
Great. So hopefully that was a good taste of what's to come within the study. I'm going to dive a little bit deeper into it, but first, I really like to highlight the people who are behind the research. So as you can see here, the Voices study team is made up of leading scientists at ACS, and specifically we wanted to include input from people who understand and respect the unique concerns of the Black community. So we have a scientific advisory board that's made up completely of Black women who are experts in women's health, and they provide guidance to strengthen this study. And the rest of our study team, from our leadership, communications team, and all our supporting members, intentionally reflect the population of Black women. And that's something that I really like to underscore when talking about the work that we're doing. All right, so Voices of Black Women is really an exciting opportunity for us to partner with 100,000 Black women. It's a really big goal, but we really want to work with 100,000 women across the nation to listen to them in meaningful ways and really uplift their stories to learn more about why we're seeing these disparities. So we want to create space for women to share their stories to help us understand their experiences, so that we can work towards a path towards eliminating these barriers so that everyone has the same opportunity to be healthy and to be cancer-free. So about the eligibility for the study, Voices is open to Black women between the ages of 25 to 55 years old who live in the United States and have never been diagnosed with cancer, with the exception of basal or squamous skin cancer. And participation in this study involves completing surveys over time. So during different touch points with the Voices study team, participants complete surveys and provide updates about their health and life experiences. And if we take a closer look at what being a participant involves, first, it takes less than 2 minutes to check if you're eligible for the study. If you are eligible, then you would consent to participate. Then you'll get registered, set up an account on our secure website, and then once you join, you'll be invited to complete surveys on the Voices website. The first survey takes about 1 hour. This is where we get to learn more about you, your health history, behavioral and environmental factors, and your lived experiences. And then you'll receive shorter follow-up surveys at least twice a year where you just provide us with some updates. And these update surveys will take just about 30 minutes. So overall, we like to frame this as volunteering 1 hour of your time per year, and you can help contribute to changes that will improve health for generations of Black women to come. And if you're wondering a little bit more about what this life and health history survey looks like, some of the questions, they reflect the standard questions that you're usually asked on health questionnaires about your demographic information, family health history, insurance, things like that. But we'll also collect behavioral and lifestyle information surrounding your diet, physical activity, the use of personal care products. This is a really big emerging topic, especially within the Black community. But we also have new data collection metrics that will help us understand Black women's lives and experiences uniquely. So things like social support, experiences of racism and discrimination. And these questions were created to specifically understand the experiences of Black women as they move through the world, to understand the whole holistic picture of Black women's health. And then quickly, the major question that we use to center ourselves in thinking about designing this study like this is really trying to understand what's driving the disparities and the differences that we see by race, place, and class. Um, and thinking about how we can begin to mitigate some of those effects, things like structural racism that aren't as widely studied. But one of the things I wanted to mention is that in this study, we don't just isolate cancer alone. So there are a lot of things that Black women are contending with, cardiovascular disease, diabetes, autoimmune conditions, things like that. And really understanding how all of these work together to drive cancer incidence and outcomes is an important component of what we're doing here. So just wanted to highlight the comprehensive nature of the study. And wanted to take a moment to really emphasize how your data safety is our top priority. Um, so essentially what you need to know from this is that your personal identifying information is kept separately from all of your other data. And that data never gets linked or associated with your individual responses in the survey or your responses to the survey questions. We use a study ID that's randomly assigned instead of your name, and we never publish individual information when we're sharing results. It's all aggregated. And just wanted to mention that all of our Voices staff are trained on research ethics, privacy, and security. And wanted to quickly pause here and mention that we know that there's a history of mistreatment in Black communities and healthcare systems. Um, this Black community has experienced medical mistreatment at the hands of the healthcare system, and it's important for us as public health researchers to acknowledge this history and address it. So, we did a lot of formative work before launching this study to work closely with Black women to get their input and feedback, and integrate that into the study. And also, it's important to know that Voices is an observational study. It's not a clinical trial. So there's no intervention. We're not withholding treatment or medicine. We're just simply asking you to live your day-to-day lives and share those experiences with us. All right, now recruitment and engagement. So we've been really grateful to get a lot of media attention with Voices so far. We've had some great partners in TV and radio. We got featured on the Oprah Winfrey Network. But I say all this to demonstrate that even with this media reach that we've had, the real power comes from women just like you. Truly, you are our most valuable partnerships as we continue on this journey to 100,000 women. Um, since Voices launched, we've enrolled just over 5,500 participants across the country. As you can see on the map here, Texas is actually one of our top performing states. So good job to all of you out in Dallas. A true milestone will be when we reach 10,000 participants because that's a critical number that determines when we can really start digging into this data and have enough information to begin seeing results. Um, so, we've got the media attention, but now is really the time to engage communities and spread the word through this one-to-one outreach. And it is truly going to be all hands on deck to make this happen. Um, I really want you all to believe that you have the power to make impact in your community and have that ripple effect that can shape the health of Black women collectively. Um, we understand the value of community when it comes to mobilizing people to enroll. So we're training to partner organizations to really deliver messages that resonate. And there's also so much power in hearing about the study from a family member or a friend. The largest majority of people who joined the study said that they learned about it from someone that we know. So we appreciate all of those who bring this to their personal networks. Um, and lastly, just to close, the Voices team needs you, each and every one of you, no matter your race, gender, anything like that, you have a role to play in amplifying the Voices study. Like I said, when Black women are placed at the center of research, we all move closer to health equity and better outcomes for everyone. So now is the time to use your voice. If you're on the call, you are a part of the solution. So I'm calling on all of you to show support in the ways that make sense for you. There's a bunch of different ways that you can get involved. You can take 2 minutes to check your eligibility and get enrolled. If you scan the QR code on screen, it'll take you to our website where you can do that. You can take a moment to share the website with at least three people you know. Talk about voices through your personal professional networks. If you have a personal connection to cancer and are willing to share your story, talk about it. Share your why to encourage eligible women to join. Um, and then, I just wanted to share that if you take anything away from today's presentation, it's that there is power in your voice and your reach within your community. So if you just take one moment to think about even one person that you know who could be a good fit for this study and take that action of sharing voices with her, that would be a great step forward because one conversation, one phone call, one text, that brings us one person closer to 100,000. So voices, it's more than just a study. We're hoping that it becomes a movement, and your voice is the one we need to make that happen. Um, so if you have any questions, feel free to let us know. We are happy to get those answered for you, but thank you for the opportunity to be here this
Kayla,
evening.
we've got a great question in the chat. So, are there certain
Sure.
time periods when the results will be evaluated?
Yes, so we're really looking towards that 10,000 participant number to be able to get meaningful results from the study. So at this point in time, we have done some preliminary results, and we've had a webinar with current participants to share what those that data is looking like. But when we can start making true conclusions from this information is 10,000 people. So we are really looking forward to getting to that number.
We have another question. Does the Cancer Society work in partnership with local state of Texas cancer institutions from women of color to participate in the studies? And if so, I'd love to be able to present this and share with my job site. This person's a radiation therapist.
Absolutely. So we are working on building out our community partnerships. Like I said, we really value those local partnerships, national partnerships, corporate partnerships. So if you are interested in having a voices presentation, I will share the email in the chat. You can share the opportunity that you have, and we will evaluate whether that's something that we're able to accommodate and, do something like this where we come in and do a webinar. So I'll put that email.
And I see a couple more coming in, but I wanted to stop and do a time check with our partners and see if we have a couple minutes for questions, or would you like for them to direct them to us afterwards?
I think we have time for perhaps one more question, and then if you're available, perhaps we can follow up.
Okay, that sounds good. So the next question is, will the findings be shared with academic entities? Can you speak a little bit to that, and then I can tie us up?
So could you please repeat the question? Sorry.
Yes, so will the findings be shared with academic entities? So any additional academic institutions that will receive the data?
Yes, so the hope is that we have large impact with the results that we have. I'm sure that we plan to do some sort of published work to show the results of voices. I'm not sure about the specifics of how that looks with sharing with academic entities, but we do want to make the results of voices widely available once we have this data and have written up some published things.
And just to add to that, one of the unique approaches to us being able to amplify voices, and Kayla did a nod to it earlier, is truly our partnerships. And we are currently in partnership with a lot of academic institutions. And so our hope is that as we continue to see and to have things to share, that those are the same partners that we'll be able to kind of share that information with and find avenues to amplify. Lots of questions coming in, and we're so, so grateful, but we'll make sure that we follow up with you all via email. If you want to just email voices@cancer.org, we'll make sure that we get those questions answered for you. We're so grateful to have been here with you this evening, and thank you for your time and your partnership. And Kayla said it best. If you take anything away from this conversation, share it. Do not let this webinar experience be the last time that you talk about the Voices of Black Women cohort study. Thank you so much to our partners for having us.
Thank you. So it appears that concludes our question and answer segment. So at this time, we'll turn it over to first VP Dillard.
Good evening, everybody. Good evening. Oh my God, this has been wonderful. So on behalf of myself, President Dr. Katrina Pullum, Zeta Phi Beta Sorority Incorporated, Kappa Zeta Chapter, the health chair and co-chairs. I got a lot of people. Charlene Powell and Carol Whittington, and the entire health committee. We sincerely thank both Mary and Kayla for sharing their knowledge and their expertise this evening. And I'm going to go ahead and share my why. I am a survivor, so I've benefited from this research. So I know that this works. So that's my why. But as we close tonight, I want to remind us that the Voices of Black Women Study is more than research, it's representation. It's about making sure our stories, our health experiences and our realities are seen, heard, and valued. For too long, Black women have been underrepresented in research that directly impacts our lives. This study is an opportunity to change that. It's an opportunity to move from awareness to action. Each of us can make a difference by participating, by sharing the information, and by encouraging women in our circles to get involved. When Black women raise our voices together, we don't just contribute to data, we create impact. So thank you for showing up, thank you for caring, and thank you for being part of the change. Our voices do matter, so thank you. So next steps are definitely to share the message. We invite you to connect with, I'm sorry, next slide, I'm sorry. We invite you to connect with us by following our social media to learn more about our upcoming programs. We do have a QR code that you can use here, and it connects with our link tree. So please connect with us, keep up with us. Next slide. We also want your feedback. We want to know what you think. We want to know. I know you want more information on all of this, and from the questions, I can see that people really, really are engaged. So that's awesome. But please go and scan and do our survey and let us know what you like, what you want more of, so that we can bring it to you. Next slide. And then our upcoming events. For those of you who are out there and who would like to get involved and be a part of NCBW Dallas, we have a brunch scheduled for February 28th from 11 to 2 at Maggiano's. So the information is out there, the link is there. So please register for the event. And then our annual fundraiser, NCBW Dallas Derby Days, will be on May 3rd, 2026. This is a fabulous event. This is this will be our third annual Derby Days. So please go out there, get a little more information. Register tickets are on sale now. So we would love for you to come out and help us raise funds to continue our advocacy out in the community. Again, thank everybody for being here, and remember, our voices matter. Thank you so much.